With the Republican Party assuming a 34-33 majority in the Senate, the caucus recently announced a restructuring of healthcare committees. Joining me now in the studio is the newly appointed chair of the Human Services Reform, Finance, and Policy Committee, Senator Jim Abeler. Welcome.
Oh, it's great to be here again. Thank you.
You and I are both relatively new to the Senate. You started in February.
Yeah.
You came in the minority party. Now you're in the majority party, and you're the chair of a healthcare committee. So as a trained chiropractor, can you treat yourself for whiplash?
They say the person who has himself for a patient, no, who said, well, I screwed it up. Anyway, they have a fool for a patient if you treat yourself. So you need somebody to help you out.
It's been a quick change, though.
Yes.
Is it exciting for you?
Oh, very. It's there's so many opportunities, and I never thought I'd be a chairman again, frankly. And then it just lands on us all of a sudden. I woke up in the morning like, what? Wow, we're in charge? Holy cow.
Mm-hmm. So political thinkers have pointed to problems with the Affordable Care Act as one of the reasons why the Republicans had such big wins nationally in this last election. You came on this program not long ago to talk about some of your ideas for healthcare reform. And now as chair of your committee, can you talk about your committee and some of your ideas for reform?
Well, there's actually two committees related to the whole healthcare thing. There's the disability services and county services part, and then there's the healthcare part. I'm actually in charge of the disability side. Okay. But all the interest and action, there's a lot of work to do, and we need to care for our vulnerable people and all that, and that's probably a different show. But there's a lot of interest in the healthcare side, and that's the marquee topic. And if that committee sneezes, it's going to be in the paper. Mm-hmm. And frankly, I think it wasn't even the brokenness that happened with the whole Obamacare thing. It was the failure of people to say, we didn't mean that. Oops, we can try to restore it. And so it became political, and so here we are with Minnesota's amazingly strong healthcare system is fracturing. We just lost Medica as a Medicaid provider. They're going to quit in May. And
right,
rates
and 300,000 people are going to be looking for new. And
people's rates have gone up 50 to 100% if you're buying your own policy. They didn't do anything wrong, and people are like, what? Mm-hmm. So it's an area that's going to take a lot of work and be really interesting to work in. Time to go back to restore Minnesota's greatness in the healthcare world.
So to just talk about your committee, though, because you said your committee is going to be focused on sex offenders, disabled. What are some things that you're looking at to try to do in that area? The key,
particularly in the people with disabilities and seniors and childcare, if you focus on the client or the person being served as opposed to who serves them, you can actually do a lot of good changes. And so we're going to step back and take a whole look at the whole panorama. How many people are we serving? How would we like to do it if we could? And let's move toward that. And what we have now is just a random collage. And we add programs and add programs. In your house, if you never clean out your fridge, you'd have to buy another fridge. Or you could go to your regular fridge, since things are falling out when you open the door, and take the two pickle jars and pour them together. Now you have one pickle jar, and you can get rid of the other empty one, and actually you just have as many pickles, and now it fits better. And sometimes the programming reforms can be as simple as that. But very often the vendors and the nice people who provide services control how we do it. And it has to be about the clients, because it's very expensive and the services are not as good as they might be, and the experience for the person with a disability or the senior is not what we want it to be. And that's my focus, and it's exciting to get to dig into that.
So let's talk a little bit about MNsure.
Yeah.
You have said that because it is an exchange and Minnesota has its own exchange, you'd like to keep it local. Other members of your party have talked about wanting to dismantle it or go to the federal exchange, and obviously things may change a lot. But is there controversy in your party on that MNsure topic? Because you seem to be a little different.
A little controversy. It's the third rail. And the people that made it up, they had to believe in it with the faith of a religion, and we thought it was horrible, and it was not very good. If the choice is having our own or having a federal one, I don't trust the feds. Even now with the changeover, I don't know what they're going to tell us. And California and Minnesota are different.
Well, so Minnesota has that history of actually serving its people well.
They're actually leading. So how about if they did what we do? Let's import good ideas. And so if we're going to have an exchange, let's have a Minnesota one that we can improve. Now we can actually do something about it. But you know, the secret is we never needed one in the first place. We have these people in Minnesota called insurance agents. If they could have lined up the subsidies with the people, you could have saved $400 million. But that's water over the dam, so looking forward, it has to work. And it still is. It's just, the MNsure is just a store. It's just a store to buy insurance at. It's not a very good store. If there were other stores, you wouldn't go there. But to get the subsidies, you have to go there, and they work with the public programs. And so I think it can be made to work, which is what I'm about.
One thing I want to talk about is the conversation seems to be about healthcare premiums and the cost of insurance. But what about the cost of healthcare anyway? It seems that nobody knows how much anything costs. For example, if you break your arm and you go to this hospital, it'll be $500. If you go to this hospital, it'll be $1,000. And if you go to a different hospital and you're uninsured, it's $2,500. So how do we know how much anything costs?
Well, we don't. In the past, I've done some work with people posting prices, but you never know all the things you have to buy. For the regular individual, they have insurance, they go, what's it cost? $50. The $50 was $500, was $1,000. Nobody cares. And so they need to care. And when it's $50, they're like, well, we'll do everything. Yeah, I would like everything done for my arm that I could possibly. I want the colored cast, and I wanted to kind of have this little special thing. If you were paying for it, you go like, I think a white cast is fine, and I'll put a little sleeve on it. And so there are some things you can control and some things you can't control. If you're very ill, you're going to spend a lot of money. But even those folks have some choices. But once you're past deductible, it's 100% paid, nobody cares. It really matters in the cost. And so, as you suggest, transparency and letting people know in a meaningful way. Do you know what you just spent? Would you have spent $30,000 for those 2 days in the hospital? No, I would not have if I would have known. I would have stayed home. And so get the care you need, but people need to know. And that's where the costs lie, and in even better ways. More conservative care. What if we tried something conservative rather than going right away to surgery? What an idea. Well, it only costs $50. Yeah, give me the surgery, you know? Exactly.
Well, Senator Abeler, that's all the time we have today, but I want to thank you for coming on. You're such a fun guest, and I wish you well in the next session. And encourage people to know it's their government. When they weigh in with us, it really does matter, especially on these marquee topics about disability services and healthcare. So reach out to your senator. Absolutely, we care.